Hi everyone, and welcome to Health Me Please, the YouTube channel where you can find reliable and up-to-date information about diseases, treatment, and prevention. Welcome back to our discussion on ischemic stroke. Ischemic stroke, which is caused by a blood clot blocking blood flow to the brain, is the most common type of stroke. After experiencing an ischemic stroke or transient ischemic attack, it's important to take steps to prevent a future stroke. The major treatable risk factors for stroke include hypertension, dyslipidemia, diabetes, smoking, and physical inactivity. A multidisciplinary team can help patients address these risk factors through a variety of strategies. One key strategy is antithrombotic therapy. Nearly all patients with TIA or ischemic stroke of atherosclerotic origin should be treated with an antiplatelet agent. Early short-term dual antiplatelet therapy may be beneficial for select patients with high-risk TIA or minor ischemic stroke. For long-term therapy, the combination of aspirin extended-release dipyridamole, clopidogrel alone, or aspirin alone are all acceptable options. Patients with chronic non-valvular atrial fibrillation who have had an ischemic stroke or TIA should also receive long-term oral anticoagulation. Another important strategy is antihypertensive therapy. After the acute phase of stroke, patients with known hypertension should resume antihypertensive therapy in order to reduce the risk of recurrent stroke and other vascular events. Patients with stroke or TIA who have not previously been treated for hypertension should also initiate antihypertensive therapy if their blood pressure is above the goal level for higher risk populations, which includes all patients with ischemic stroke or TIA. Lowering LDL cholesterol is also crucial in the secondary prevention of ischemic stroke. For patients with atherosclerotic cardiovascular disease, including TIA or ischemic stroke, high-intensity statin therapy is recommended to lower LDL cholesterol to less than 70 mg per deciliter. For patients who are intolerant of high-intensity statin therapy, the maximally tolerated dose of a statin should be used. For patients whose LDL cholesterol remains above 70 mg per deciliter despite maximally tolerated statin therapy, adding ezetimibe or a PCSK9 inhibitor may be reasonable. For patients unable to tolerate any statin regimen, ezetimibe should be used, and a PCSK9 inhibitor may be considered if LDL cholesterol remains above 70 mg per deciliter. Thanks for watching. If you want to stay up to date with all of our latest videos, make sure to hit that subscribe button and turn on notifications so you never miss an update. Finally, we want to remind you that the information we provide on this channel is for educational purposes only. If you have any symptoms that you suspect may be related to a particular disease, it's important to see your doctor as soon as possible.